It's about 1 year since the story of COVID-19 started in Nigeria through an Italian, the index case of the virus in the country. Since then, the country has lost over 1,900 people, and there's been over 1.5 million samples tested, and out of that, 157,000 confirmed cases, of which 136,000 have been discharged. Discourse on COVID-19 may change as the country has joined others when Dr. Cyprian took the first jab from almost 4 million doses of AstraZeneca, which was shipped into the country. How will all this play out in the fight against the pandemic? Let's talk about that on this episode of Special Report. You're welcome. I'm Inni John Mekwa. Coronavirus, which was later named COVID-19, shocked the world, overwhelmed health systems of even high-income countries. Predictably, the situation has elicited social and medical responses from the public and government. The incidence of COVID-19 grew steadily in Nigeria, moving from an elitist pattern to community transmission. The fatality stands at about 2.8% as the country recorded an upsurge after the lockdown was eased, with the country entering into its second wave late in December 2020. A combination of non-pharmaceutical and medical responses to a large extent has helped curtail the spread of the virus.
We can flatten the curve and defeat this virus only if we take seriously the advice and the guidelines being issued by authority regarding prevention, treatment, and general behavior of each and every one of us at this difficult period. As we are aware, Lagos State remains the national epicenter of this disease. As at the 17th of January 2021, Lagos has recorded a total of 41,374 confirmed cases of COVID-19. Of this amount, over 28,452 have recovered and are within the community, while about 9,213 are currently active in the community. Over the past 11 months, about 3,776 COVID-related patients have been admitted into our various care centers with a registered fatality rate of approximately 0.67%. To date, we have 277 fatality cases. So what's been our testing strategy? One of the greatest hallmark of the Lagos State response has been the state's robust testing strategy. In addition to the 4 public laboratories providing free testing under the public health response, the state has increased the number of private providers under the private laboratory consortium to 20 private laboratories. These laboratories are also providing service to both our inbound and outbound international travelers, work-related activities, or anyone that is curious about their COVID-19 status. The formation of the consortium has significantly increased our testing capacity, with the state now conducting between 2,500 to as high as 3,500, almost 4,000 tests per day.
Economic activities at the nation's commercial center, Lagos, was crippled at the peak of the outbreak, and the lockdown declared to curb its spread. Managing the first wave of the deadly virus was a big task for the state government. Several isolation centers sprang up across the state to help in the care of people who had contracted the virus. Frontline health workers had their hands full taking care of patients. They worked tirelessly, providing care and even more care.
Why are we here?
Then came a proposal by youth to end the continuous operation of the Police Special Anti-Robbery Squad, SARS. Across the length and breadth, youth came out en masse for the protest. At this point, there was no consideration for the outbreak of COVID-19. They were not bothered about social distancing and other safety protocols. Months down the line came the festive period, and residents threw safety caution to the wind. The number of infections spiked, ushering in the second wave.
Experiences from other nations that have
eased up the lockdown, there have been spikes. Even our sister country very close by, Ghana, 10 days after the lockdown, the figures just went up. Germany had that experience. Several other countries have experienced that. And everybody is navigating the rough road, trying to find a solution to it. Part of what I see them do is that they try as much as possible, in spite of the spike, to ensure very strict compliance.
So far, the state has recorded over 50,000 cases with over 47,000 recoveries across communities and 300 deaths. The state government says the battle continues and is asking all residents to adhere to safety protocols.
The situation now is that we have to protect ourselves. We don't want any mass death that can affect the situation in the country as at now. The advantage here is maybe because of the heat, it's not that very ferocious, but it's dangerous, it's real. So I will advise people to abide by keeping themselves safe. The coronavirus is very, very lethal. It is not something we can toy with, so we should be serious about it.
Looking at the story of COVID-19 in Nigeria since it marked its debut in February 27, 2020. Since then, there's been almost 1.5 million samples collected for testing, and there's been over 155,000 confirmed cases, over 132,000 recoveries, and more than 1,900 deaths. In a pie chart representation, the number of people who have recovered so far is about 85.5% of all confirmed cases, with 20,000 active cases representing about 13%. Lagos, Abuja, Plateau, Kano and Oyo State are the most affected, with the highest number of confirmed cases. Lagos is the epicenter, with Abuja coming in distant second, both major international flight routes. Kogi, Zamfara, Yobe, Cross River and Kebbi states are the least affected according to statistics. Kogi has not recorded any case for several months, and Cross River just had its test center restored after the NSAS incident. Dr. Chikwe Ihekwazu is the head of the team that controls infectious diseases in Nigeria. He speaks more on the efforts of federal government at containing the spread of the virus.
For us at NCDC, our response continues. As much as vaccines provide some light, very important light, but the response has to continue. We have to continue our surveillance, we have to continue our testing, we have to continue protecting our healthcare workers with the personal protective equipment that we're doing. We have to sustain the critical investments that we've put into our health security infrastructure for the first time in decades. We cannot let this go because we have to continue this work. So that's the work we will have to continue doing, supporting our colleagues at MPHCDA who will now be leading the response, but also continuing to drive risk communication, educating Nigerians on the benefits that vaccines will provide to them, but what they need to continue doing throughout this response. And of course, we've all heard about the risks of emerging variants of the virus. As viruses are transmitted from one person to the other, there's a risk of new variants emerging. But the fact that there's a new variant in itself is not a problem. The challenge is when that variant has an impact on the efficacy of vaccines, i.e. how well vaccines offer the protection that has been predicted. And that's what we have to now study very carefully in our context, and we're making plans to do so as we roll out this service. There'll be many new variants. I won't bore you with all the details, but the key thing is to understand that the fact that Brazil was able to identify that there was a variant that led to a reduced effectiveness of the vaccine wasn't by chance. It's because they looked. They looked by having the studies in place and executed in order to find that impact. And that's exactly what we're planning to do over the next few weeks here. I'll end by appealing to Nigerians. It's been a tough year for all of us, as we have given up so much of what makes us who we are. We have limited our celebrations, limited our opportunities to eat together, to dance together, to pray together, to be the people that we are. But we need to hold on for a little while longer so that we can consolidate the gains that we've had over the last year and make sure that we come out of this in a good place.
A boost in the health sector to combat the deadly coronavirus which has killed thousands of Nigerians. On the 2nd of March 2021, Nigeria took delivery of nearly 4 million doses of the AstraZeneca vaccines provided by COVAX as part of global efforts to ensure equitable access to COVID-19 vaccines.
This is really the moment that we've been waiting for. 4 million doses of the AstraZeneca vaccine. From what we've heard from the Serum Institute of India and the Indian High Commissioner, this is one of the largest consignments of vaccines that has been delivered to any country globally. Just like we've communicated over the last few weeks, these vaccines are going to be coming in batches. From the COVAX facility, we expect 16 million doses of these vaccines between now and the month of May. This is the first batch of the 4 million. So in the course of the next few months, we expect additional doses. Do not forget that apart from the COVAX facility, we are also expecting vaccines from the African Union through the AVAT platform. We're expecting some 41 million doses of vaccines from the African Union, made up to 22.9 million doses of AstraZeneca and about 18.4 million doses of the Johnson & Johnson.
I would also like to say that as a gesture of goodwill, in addition to the supplies through COVAX, India will also be donating 100,000 doses of vaccines for Nigeria, for which we got the approval yesterday, and it will be coming shortly as well.
More African countries, including Angola, Kenya, the Gambia and Democratic Republic of Congo, have also received the long-awaited vaccines.
Will align with the planned arrival of vaccines in batches. Each phase targets a specific segment of our eligible population to ensure equity in the vaccine deployment. The defined frontline healthcare workers are prioritized globally for vaccinations against COVID-19 due to their higher exposure to the risk of infection with COVID-19 in the course of duty. It stands to reason that this protection is not only for their own sake, but also for our own sake, since any one of them absent due to illness means, again, a depletion in their ranks and can forebode staff shortage. It therefore makes sense to cater first to those who cater to us. The vaccines are more than enough to go around, and they'll be coming in phases. Persons under 18 years and pregnant women are for now not eligible except they have been medically certified as vulnerable due to one underlying ailment or the other.
On behalf of the President of the Federal Republic of Nigeria, the government and the people of Nigeria, I salute our heroic frontline medical personnel for their professionalism and commitment to saving lives. For us in Nigeria, and indeed nations of the world, the lessons from this lack of discrimination by the virus are numerous. They include the fact that we must approach the vaccines phase with unity of purpose. 2, we must understand that nobody is safe until everyone is vaccinated.
And 3, we must recognize that vaccine hesitancy will impact negatively on our lives and those of our loved ones if allowed to foster. 4, we must demonstrate at all times that this is a war of MPIs plus vaccines for the survival of everyone. And 5, we must believe our government on the safety and efficacy of the vaccines brought to Nigeria. And lastly, we must support the planned and systematic rollout of the vaccines and mobilize our citizens as we move into the states.
A few vials of the vaccine was handed over to NAFDAC team for analysis and clearance. The Presidential Task Force, Federal Ministry of Health, National Primary Healthcare Development Agency and strategic leaders converge for the first vaccination of critical frontline healthcare workers who are providing essential care.
Dr. Cyprian Igong from the National Hospital. I was reliably informed that he has been at the isolation center from March 2020 when this pandemic broke in Nigeria.
We've been at the forefront of the COVID-19 fight here in National Hospital, our isolation center, under the able leadership of the National Hospital. They've provided everything we need for this fight. We've lost some, we've got some, and we are happy we are getting the vaccine now in Nigeria. I think that is about the best news we've had since. I only wish my dad had had that vaccine maybe months ago or so. We lost him, but we thank God. And the fight is still on and we will win. Thank you. Well, you can see I just took the vaccine now, and I feel good.
President Muhammadu Buhari and his vice, Professor Yemi Osinbajo, follow suit on the 6th of March.
The speedy development of the coronavirus vaccines is quite significant and underscores the collective resolve of humanity to overcome the pandemic. Similarly, the collaborative effort to ensure equal access has brought relief to poor and developing countries. I have been assured by the Presidential Task Force that the AstraZeneca vaccine, which Nigeria has accessed, will arrive in batches, beginning with the first batch of about 4 million doses already received. I am similarly aware of the rollout and administration plan to cater for over 70% of our population between the year 2021 and 2022. Today is a demonstration of leadership and faith in the safety and efficacy of the vaccines. I have received my first jab, and I wish to commend it to all eligible Nigerians to do same so that we can be protected from the virus. I urge all state governments, traditional and religious leaders to take the lead in the mobilization effort within their environment and spheres of influence.
More vaccination sites will be set up at designation locations such as the National Assembly Clinic, State House Clinic, Federal Medical Center Jabi, where strategic leaders such as the SGF, Senate President, Speaker of the House of Representatives, Attorney General of the Federation, the Inspector General of Police, the ministers and ministers of states, senators, House of Representative members, traditional leaders, and religious leaders are expected to be vaccinated.
Our own staff are getting ready. We are training other staff in terms of pharmacovigilance. Because once the individual gets the vaccine, our work starts in terms of pharmacovigilance, asking what is going on, things like that, and making sure that it is recorded. Because we join the global world by also contributing our own data, that this is what we have in Africa or in Nigeria. So that is what we are doing. In terms of general safety, there is no drug, no medication or medicine that doesn't have side effects. But because this is such a new vaccine, we are paying more attention to it. Is it just ordinary side effects, my arm is sore and so on? Or it is that I feel so weak for 2 days or 3 days, So we're going to note all those. And those will be compared. In fact, part of what we are doing at the African continental level is to also compare data from Nigeria, as an example, with data from South Africa.
After the initial rollout phase, vaccine distribution to states for the Phase 1 vaccination process begins with the deployment of vaccines to states and will be based on the assessment of their level of preparedness in terms of their cold chain storage facilities, preparation for transportation to ward and health facilities, adequate security in place during transportation, adherence to protocols for vaccine deployment. The Phase 2 of vaccination process involves the vaccination of the elderly with age range from 50 and above. This process has been subgrouped into two, with the vaccination of those who are 60 years and above first, followed by 50 to 59 years. This will occur across 36 states and the Federal Capital Territory. However, those eligible for vaccination will have to register electronically, while the elderly will be assisted to register at designated health facility. The third phase of the vaccination involves those between the age of 18 and 49 with comorbidities such as hypertension, diabetes, lung disease, and other heart diseases, as well as liver or renal diseases. Population age range between 18 and 49 takes the Phase 4 process, which involves vaccination of the rest of the eligible population. Pregnant women are expected to be evaluated by their health providers to weigh the benefits and risks before a decision is taken.
The next thing is to look at vaccine as a game changer. It's critical addition to our strategy. But let us not make the mistake of thinking that it is a replacement for everything else. It is not. It is an addition to the strategy. It's extremely important to bear that in mind, please. Vaccine, because of fake vaccines running around, it's been mentioned in very many countries. We are buying vaccines only from known sources. The COVAX, the AVAT of the African Union, and the bilateral agreements that we have with countries directly. We are not buying from private sources or importers where we do not know the background of where the vaccine is coming from. It's too risky. The administration of vaccines is by now, for now, the sole remit of National Primary Healthcare Development Agency until a point where they begin to fan out to additional administrators. And let us say that the NPHCD has a lot of experience. They are very well prepared. They have institutional memory, and they have the capacity, and they can even administer these vaccines to closed groups or closed settings. If, for example, you want that in a particular area, you can make an application to them for that. I also wish here to acknowledge West African Health Organization, with whom we are working. It is very important for us that our neighbors, because there's no use if we are fully vaccinated, we get herd immunity, and our neighbors are not, and we We have open borders where they come in and go out. So we work in the West African Health Organization to ensure that in our region, in fact, in the African region, no country is left behind, even because they have no money or they have no money, they are not able to pay immediately. We support that initiative. The government of Nigeria supports the whole of Africa approach so that, as the DG of WHO has said, no one is safe until all of us are safe.
The recommended vaccine dosage is 2 doses given intramuscularly with an interval of 8 to 12 weeks. The AZD1222 vaccine against COVID-19 has an efficacy of 63.09% against symptomatic SARS-CoV-2 infection. Longer dose intervals within the 8 to 12 weeks range associated with greater vaccine efficacy. So are you ready to take your jab? Well, share your thoughts with us through Twitter or our email. And that's it for this episode of the program. I'm Ini John Mekwa.